Hey, so it's a pretty long week. I started my day on Monday with the intention of having my knee being given the MUA, which is a manipulation under anesthesia. Essentially, what they do is they take you into the operating room. They put you under usually general anesthesia or propofol, and you're knocked out. The goal is to get your knee to bend as much as possible from a complete knee replacement. So my knee over the past 3 months has gotten to a maximum, and I'm being generous here, about 105 degrees, maybe 104, 103 on a bend. And then straight, they'd like you to be between 0 and 5 degrees. So I've been pretty consistent in that window of 0 to 5, depending upon the day. Sometimes 5, sometimes 3. I don't know if I've hit 0 yet, but that flexion on my good knee, which isn't really that good, I think I'm at like 117. Um, so I'm trying to get even at that on my new surgically repaired knee. And in the OR, when I was done, excuse me, the doctor told me that he was able to get it to 115. And one of the reasons for that was I have a crown and it got infected. I guess I got a little cavity that got caught in there. I grind my teeth at night, so I wear a mouthpiece. So, long story short, it got infected. They don't like to do surgeries, especially with acute infections, because when you have metal in your body, like I do, I'm like almost half metal. My hip, my neck, my back, my knee. The metal will attract the infection because there are no white blood cells flowing because it's metal. And therefore, you have a greater risk of having a severe reaction where they may have to go so far as to remove your knee, give you a temporary one, if you can believe that or not. And then once the infection abates, they can reinstall another new knee. Once was way more than enough for me. They say, I think I mentioned this before, that a knee replacement, complete knee replacement, is one of the worst surgeries you can have. And I had my surgery on January 13th, and I am nowhere out of the woods yet. So I went on Monday to the dentist, and I had to have a cavity filled because I cracked my tooth from grinding it. So it wasn't really a cavity, but it was a crack nonetheless that was compromised. And I had to get a filling, and I had to get antibiotics, and you needed to be on them between 3 and 5 days. So I did that. I was planning on having the MUA done on Monday, so I had taken a day out of work. So I go to work on Tuesday. They call me and they tell me they can do the MUA on Wednesday. So I show up at Mount Auburn Hospital in Cambridge, and Dr. Chris Damsgaard, this guy is the best. If you want a doctor for a hip or a knee replacement, you will not find a better doctor. This physician is smart, intelligent, incredible bedside manner, just a really nice guy and empathetic. Like, he understands, he'll give you pain meds. He's not like going to send you away with some Tylenol and Motrin and say, you know, let her rip and go from there. Like, that's just inhumane. So, Chris Damsgaard, in my book, is out of my over a dozen surgeries, is probably the best surgeon I have ever had operate on me. So just a shout out to him. So on Wednesday, I got to the hospital at the appropriate time, 12 o'clock, and I had to wait 3 hours. They were doing a hip replacement for another patient, and then they have to clean the operating room. So I got in there at 3:09, and it's only a 10 or 15-minute procedure. But what they have to do is basically get your knee, and then they got to crack it and break all the scar tissue and increase the mobility, while at the same time, don't break the tibia or the fibia, don't tear any ligaments, your hamstring, specifically your MCL, your ACL. It's really careful and specific when you're doing that flexion. Women tend to have less muscle than men, and I'm a fairly big guy to begin with, so I'm not a flexible guy. Never have been. I played varsity sports on the college level, baseball and basketball. I've boxed. I've been athletic my whole life, but I was never really flexible. At one point, my best bench was 315 clean. I did that for one rep. I could do 225 for a good 12 to 15 times. And I routinely would work out every day, trying to be careful because I have had 5 back surgeries as well. So that being said, I went in on Wednesday, and I was really stressing. Like, I was nervous. I was like, this is going to hurt more than the surgery. But to be honest, when I came to, I felt a lot better. They medicated me properly, and I went to Shake Shack afterwards. I got a burger, got a shake, and my wife was nice enough to not only buy me lunch, but to help me out with it. And she then drove me home while I was in the back seat with my legs stretched out. So home, and I thought as the pain medicine and the anesthesia wore off that I would be in more pain. I was lucky that I wasn't, and I felt really, really good. On Thursday, which was yesterday, I felt a little more sore. Kind of, took the pain meds at a minimal because my plan is today is going to be the last day on the pain meds. I only resumed them because of this procedure. And I've got physical therapy on Monday, but obviously today and over the weekend, I'm going to be working out that knee because I certainly don't want to go backwards again. So I've got a lot of advice if anybody, needs any advice if they're looking at knee replacement, hip replacement. I have had both. I had my hip replacement done in 2009. They said that was a 10-year shelf life, and here we are in 2026. And I played from 2009 to 2019, so 10 years I played baseball, both in the Rhode Island Men's Senior Baseball League and the REMA League. So both leagues I played, and I played at a pretty high level until the end when my knees just didn't want to do it anymore. So I couldn't run. Could still hit, could still throw, could still field, but if you don't have any wheels, you're really not going to do much. So I kind of hung it up in 2019. But who knows? If this knee gets better, they say you could take upwards of a year, then maybe I could play again, even on a limited basis, and maybe do some DHing, play first base, things like that. From a cognitive point of view, sleep really sucks. Every morning I could set my watch. I wake up at about 3 o'clock. I make myself a hot chocolate. I watch TV for an hour or two, go back to bed, sleep for a few more hours, and then I'm at work at 9 o'clock. So I'm hoping that now that today's going to be my last day of taking any pain meds, my body will now start to readjust, and I'll be able to hopefully, after all this time, get some type of good sleep hygiene, which is really important. And I tell a lot of my patients, I just had one who's a PA and he's having problems sleeping. So we were talking about benzodiazepine treatment for sleep disorders, but that's just for a short term. That's just to solve the problem until we could find a more adaptive problem for the patient to. There's DFA, difficulty falling asleep, and EMA, which is early morning awakening. So those are the two primary issues that people usually suffer from when they have poor sleep. And we're going to try to work on that to help them with that. So it's been a tough week between my dental issue, the infection, the manipulation under anesthesia, the MUA, and this 3.5 month odyssey of dealing with this artificial knee that is just, I mean, they literally cut off your tibia to make it flat and your fibia to make it flat. They put two metal plates that are cobalt and titanium, and then they jam it into the tibia. They also have to shave the back of your kneecap, make that smooth, put a nice surface on that. They're going through the ligaments. The joint obviously needs to work. That's where the scar tissue develops, and the soreness, the inflammation. You need Motrin to reduce that. So it's a journey. Believe me, it was and is a very, very significant journey for me. So I've been battling that, and after all this time, I hope that in the next couple of months that I'll be a little bit better than I already am, and hopefully I can move on to the next level. So that being said, again, if anybody has any questions on any type of joint replacement, I've got a lot of experience on those two elements of my hip and my knee. Outside of that, the week was just typical, 8-hour days of seeing patients and trying to do the best that I can, excuse me, to try and deliver the best services that I can to my patients, to be empathetic, non-judgmental, try to give them a really good treatment plan that's designed specifically for them, and just hope that when you're working with patients, everybody is an individual. Everybody needs to know that when they're working with a licensed therapist, that therapist is qualified, is capable of knowing diagnostically what they need and how to achieve it. And it's not what the therapist wants, it's what the patient wants. So the therapist's job is essentially to be a tool. So the patient tells the therapist, this is where I want to be. The therapist makes recommendations on interventions, and then we try to narrow that gap to get the patient from where they are to where they want to be. And essentially, that's therapy as in simple terms and very, very garden variety terms. Now, don't get me wrong, we have patients that are very, very significantly impaired with really what we would call heavy hitter diagnoses like schizophrenia, borderline personality disorder, behavioral issues, everything from murder to rape to child abuse to maladaptive behaviors that they have had for a very good portion of their life. And it's really important to be able to develop a therapeutic rapport with these patients and try to get them to understand the importance of psychotherapy. And it's almost like going to the gym. If you don't commit and go as often as you can and really give it your all, you're only cheating yourself. And as far as medications, psychopharmacologically, that is something that always comes into play. And now that prescribers have grown to PAs, which are physician's assistants, they have usually a form of a master's degree and they work under a medical doctor. Then you have NPs, nurse practitioners, which are kind of like a level up. They have a very significant master's degree and they work again under physicians. And then you have your medical doctors, which hopefully are psychiatrists who have specialized in behavioral health and substance abuse, addictions, things like that. And what they bring to the table is not only a wealth of knowledge from medical school and their training, but also their day to day working with patients that have all of these issues that need to be corrected for the benefit of the patient and sometimes for the benefit of the patient's family, their significant other, and anyone else that's associated with them, work, social, legal, personal, whatever the case may be. So I don't want to run too much longer, coming up on about 17 minutes. So I hope that this has been helpful, and I would be more than happy to answer any questions you may have on either mental health, substance abuse, which includes not only substance abuse, gambling, uh, you know, inappropriate behaviors, things like that. Uh, if you have any type of mental health, behavioral health issues, we can always explore those. And even though I'm not a physician, I would be more than happy to tell you about my experience and what I have learned the hard way in terms of what to look for, the questions to ask as a patient to the physician surgeon who's going to be doing these procedures on you, and knowing that when you go into that OR and lie on the table, that you're in the best of hands and you have a game plan moving forward where they're not going to hand you a script of some Tylenol and Motrin and say, hey, good luck, because I'm here to tell you, you get a back surgery where they're going into your back and your nerves. I've had plates in my neck right down to the spinal column. I mean, right there. One little, unfortunate snip, and you're looking at a quadriplegic. So there are a lot of very important variables that need to be discussed. So, not a physician, I am a very highly educated individual with my 4 degrees, my 2 licenses, my who's who, that I belong to, the American Counseling Association, my substance abuse and addictions counseling, all of these over the course of 25 years after I left the military, law enforcement, corrections. I decided to go on a different path, and I'm really glad that I did. And as I wind up my career with, maybe another, my birthday's coming up, so like maybe 7 years, if I go that long, just like to try to give the best service that I can possibly give. I am on Psychology Today, so if you need to reach out to me, you can do that, as well as DM me here, and I'll be glad to do whatever I can to help you. Whether it's a formal session, which we can always work on depending upon insurance or your ability to pay. I can do a sliding scale. We can be creative when it comes to that. And if you just need a quick question answer, I'll be more than happy to do that. So have a great weekend, and I hope to hear from you. And God bless.